Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the glimpse of hypothyroidism and few of its categories. In today's video program, we will have some of the clinical features and symptoms of hypothyroidism. The word hypothyroidism means low thyroid hormone levels. The word hypo means low, whereas the word hyper means high. Now, before proceeding further, let's have a quick revise of thyroid hormone formation. Hypothalamus secretes thyrotropin hormone, which is TRH, and anterior pituitary secretes thyroid stimulating hormone, which is TSH. Thyroid gland secretes thyroid hormone, which is T3 and T4. Now, we will see how exactly the hypothyroidism or low thyroid hormone levels will affect on different organs of our body. In hypothyroidism, goiters can be seen both in hypo as well as in hyper. In both thyroid imbalances, goiter can be seen, which is the enlargement of butterfly shape of gland. In hypothyroidism, goiters commonly seen because of low iodine levels, where the thyroid follicles will not release the functionable thyroid hormone, because of which the goiter arises. Now, we see how exactly the low thyroid hormone levels will affect on brain. It decreases the sympathetic nervous system activity, which lead to lethargy, fatigue, depression, and memory loss or memory deficiency. The low thyroid hormone levels, how they affect on liver, where the low thyroid hormones will decrease the LDL receptors, low density lipoprotein receptors, which releases the cholesterol and triglycerides. These are the few common features and symptoms of thyroid gland, brain and liver. Now let us see how low thyroid hormones will affect on cell metabolism. In function of thyroid hormone, we have seen that the thyroid hormone will increase the usage of oxygen level, but whereas in hypothyroidism it decreases the metabolic activity, where the ATPs will decrease and glycosis. The glycosis is breakdown of glucose into uric acid, the energy which is being used for generation of ATPs. Then decrease of lipolysis. This is breakdown of glyceryls into free fatty acids. Then decrease of glycogenolysis. This is the process breakdown of glucose 1-phosphate and glucose. When these decreases, then when the process of ATP decrease, glycolysis, lipolysis and glycogenolysis, then the heat will also decrease. When the heat decreases, then the body temperature will decrease. When the body temperature is decreased, then the patient will be cold resistant. That's the reason why in hypothyroidism we see that the patients are cold resistant. Apart from this, low thyroid hormone levels will also affect on the reproductive system, where in males they decrease the testosterone and in females they decrease the estrogens, which leads to infertility, right? And even low thyroid hormone levels will also make changes in the menstrual cycle, which can lead to oligomenorrhea and amenorrhea. Now these are the few signs and clinical features and symptoms of cell metabolic activity and reproductive system. Now let's see how exactly the low thyroid hormone levels will affect the bone and muscle function. We start with bone. We have seen in the function of thyroid hormone that the thyroid hormone will increase the bone growth and increases the maturation. Where the low thyroid hormone levels are in hypothyroidism, the bone growth will reduce and the maturation will also reduce. Whereas in muscles, weakness, myopathy and reduce contraction will rise due to the low thyroid hormone levels. Now let us see low thyroid hormone levels or in hypothyroidism, how it affects on gastrointestinal tract. In the function of thyroid hormone, we have seen that it increases the motility and it increases the secretion, where low thyroid hormone levels will decrease the motility and it will decrease the secretion, which can be a cause of constipation. That's the reason why in hypothyroidism patient complains of constipation. Now let's see how thyroid hormone will affect on normal cardiac output. If you remember, in the functions of thyroid hormone, we study ADR-B1 receptor, which is beta-1 adrenergic receptor. This will help the thyroid hormone to increase the contractility of cardiac muscle, which in turn increases the stroke volume, which in turn increases the heart rate, that in turn increases the blood pressure. When the thyroid hormone levels are low, then there will be a mild decrease in the contractility, which affects the stroke volume. Then the heart rate will be decreased. When the heart rate is decreased, what we call the low heart rates, bradycardia. And as these all are low, the blood pressure should also be low, but normally the blood pressures will increase. The reason why, where the vasoconstraint of the blood vessels will increase due to the low thyroid hormone levels, which in turn increases the resistance, that will increase the pressure. There the blood pressures will increase, which can be a cause of secondary hypertension. Both hyperthyroidism as well as hypothyroidism can be a cause of secondary hypertension. Now let us see the low thyroid hormone effects on skin. We have seen in the functions of thyroid hormone that it will dilate the blood vessels of the skin to reach the blood, where the low thyroid hormone levels will not able to reach the blood properly to the skin, which in turn results the pale and hair loss and brittle nails with low sweat. As the normal thyroid hormone function, the sweat glands of the skin will work and produces the sweat on the surface of the skin, which the low thyroid hormone levels will decrease the function of this glands, that reduces the sweat. These are the few clinical features and symptoms of hypothyroidism. In our next video, we'll meet again with few more information about thyroidism. Thank you.